we've been talking about statin drugs and how the new recommendations are, don't look so much at the LDL level, the lousy density lipoprotein level, but really look instead at the global risk for the patient. I think that makes a lot of sense. Don't get so hung up on the numbers. If the numbers are super screaming high, you want to get serious. And I totally agree with that. If an LDL is above 190, which is the new guideline, you got to treat it somehow. You want to bring that LDL down to around 100 if you can. That's a good number. But you want to look at the other risk factors too. You want to look at cardio-CRP, that's C-reactive protein related to the heart. And is that inflammation number high? Well, that makes me more likely to want to be more aggressive about getting that cholesterol down. Is the homocysteine high? Homocysteine, homocysteine. If that's high, you want to add some B complex vitamin, and you also want to be more aggressive about cholesterol reduction. Is there a real high heart risk? Did your dad have a heart attack at 46? Man, you want to get aggressive. Anything that suggests that you have a higher risk than the average person, more aggressive. More aggressive doesn't mean more drugs. I'd like to see less statins and more prevention. That means more exercise. Diet doesn't mean no meat. It means not eating a whole bunch of junk and too much carbohydrate. And don't eat the edge of the meat, that fatty rind. That's bad for you, no doubt. Diet has about a 5 to 10% effect on cholesterol, so it's not super big. But what does is red yeast rice. A red yeast rice 600 milligram capsule has equivalent to about 6-8 milligrams of a statin drug with way lower side effects, proved by a group of doctors out of Abington, Pennsylvania, did a study that showed that the likelihood of having a problem with side effects is way lower with these natural agents. A good quality, pharmaceutical grade red yeast rice has excellent results with reduction of cholesterol. Also, plant stanols and sterols. Stanol, S-T-A-N-O-L, sterol, S-T-E-R-O-L. Plant stanols and sterols can give you a 10 to 20% reduction in cholesterol levels as well. We know that polycosanol, which is a wax extract from sugarcane, also drops your cholesterol. So we have lots of natural agents that are potent. They're effective. They can reduce your cholesterol. If these agents are used, side effects are much lower. And in some of them, there are no significant side effects to speak of, less than 1%. In the statin drug category, there's lots of side effects. The estimate is that they're somewhere as high as 25 to 50%. In some way. They may be mild, but they're still there, and it matters. This is your life, and you'll do it the rest of your life. This is prevention. So we want to look at statins as, let's use less statins and more natural treatment. More exercise, more healthy diet. Some of these natural agents, a polycosanol, by the way, is about a 10 milligram dose, and the stanols and sterols, it depends on the manufacturer. But a good naturally oriented doctor will know these things, and you'll be able to get access to these things from them. But I really want to encourage you. Less statins is a good thing unless you can't be controlled with natural agents. If natural agents and natural approaches don't work, statin drugs are very reasonable if you're closely monitored, look at your liver enzymes, and make sure your side effects aren't out of control. So I really want to encourage you. Less statins is the whole point. More natural treatment. Get with your doctor. We're better together.